Save your own life in an emergency. With an open immediate critical medical record, an unnamed.com pronounced a non-med. Atrial fibrillation is an irregular heart rhythm that becomes more common with age. At 50, about 1 to 2% of people have AFib or AF. This rises to 4 to 5% by age 60, around 10% by age 70, and 15% or more after age 80. Age is one of the strongest risk factors, but other medical and genetic factors also play a role. Genetics can influence the risk of developing either paroxysmal, which is intermittent, or permanent AF. A family history of AF raises your chances of developing it, and researchers have identified several genes linked to the condition. Mutations in genes. PTX2 and KCNQ1, which are involved in heart development and electrical signaling, increase risk. Inherited forms of AF are more common in younger individuals without other risk factors. Other risk factors include high blood pressure, heart diseases like coronary artery disease or heart failure, and conditions such as diabetes, obesity, and sleep apnea. Lifestyle factors like heavy alcohol use, smoking, or prolonged endurance exercise can also contribute. Thyroid problems and lung diseases such as emphysema or COPD also increase the likelihood of AF. As atrial fibrillation is an irregular and often fast heart rhythm, this increases the risk of complications like stroke, heart failure, and even death. Stroke is a key concern because blood can pool in the heart, particularly the left atrial appendage, forming clots that may travel to the brain. Heart failure can develop over time as the fast irregular rhythm weakens the heart. Tachycardia, or a racing heart, often described as my heart is jumping around or racing fast, called palpitations, which may feel alarming and unpleasant. Unusual fatigue, shortness of breath and chest discomfort, and anxiety about the condition all reduce the quality of life. Symptoms should be checked by your doctor if you have never had AF. As other causes need to be excluded, you could be having a heart attack. Anticoagulants, blood thinners, are often used to lower stroke risk. Warfarin is effective, but requires frequent blood tests and higher risk of brain bleeding. Direct oral anticoagulants, DOACs like apixaban, are newer options that are at least as effective as warfarin in preventing strokes. A DOAC has a lower risk of brain bleeding, but may slightly increase the risk of gastrointestinal bleeding. No need for regular monitoring with blood tests, which can be painful and more expensive, making them more convenient for most patients. Other treatments include antiarrhythmic drugs, but possible rare side effects like stroke, more dangerous rhythms, or even death. Beta blockers slow heart rate may cause fatigue or low blood pressure. However, slowing the rate to 100 or below is important. BP should be monitored, especially if you have other medical conditions, and take several medications for high blood pressure, heart failure, etc. Take care standing up. Go slowly, not suddenly. And if you feel dizzy or fall, then see your doctor or go to the hospital, even by ambulance if persisting or you pass out. Cardioversion resets the heart's rhythm using either an electrical shock or a medication, with shock being more successful. Shock risks include procedure failure, stroke, minor burns, or rare anesthesia side effects, as heavy sedation is required for a shock. To reduce stroke risk, a procedure called a transesophageal echo, or TOE, and TEE should be performed to exclude clots before cardioversion is attempted. If no clots, then the shock is delivered, in the same procedure with continued sedation. See my other video about cardioversion for AF. The success rate of chemical or electrical cardioversion ranges from 60 to 90%, depending on factors such as age and how long you have had it for, but may recur. Ablation, where problem areas in the heart are destroyed using heat or freezing, is usually effective, but carries small risks like bleeding as well as stroke. As it is an invasive procedure, there are extra risks, including those from sedation and anesthesia. It also has success rates from 60 to 90%, though AF can recur later. Your doctor will help you choose the best treatment based on your specific needs, balancing costs, risks and benefits to protect your overall health. If you have atrial fibrillation, or if taking blood thinners for heart or brain, have major disease or allergy, then there is one other way to reduce your risk in an emergency. Mainly when you cannot communicate if collapsed or semi or unconscious, or after a serious accident, and especially so if bleeding heavily from any cause. Unnamed can reduce risks, particularly for travel to foreign countries, as it translates into the local language for doctors to see immediately. They scan the QR code on your locked phone screen as you will not be awake to unlock it, and they won't know the code. Save your life and maintain privacy. Create your anonymous record which can safely be displayed with no identifying information. Medical record hacks are increasingly common, and ID theft is another concern, even blackmail for some. Go to unnamed.com.